What if I told you that polycystic ovary syndrome has almost nothing to do with cysts at all? What if the name of the condition itself has been misleading millions of women for decades, causing confusion, delayed diagnoses, and treatments that never fully address the real problem? Because here's the truth most people never hear clearly. PCOS is not primarily a cyst problem. It's a metabolic and hormonal signaling problem. And once you understand what's really happening inside the body, PCOS suddenly makes sense. Your symptoms, your struggles, and why so many conventional approaches only partially work. Stay with me, because by the end of this video, you'll see PCOS through a completely different lens. I'm Dr. Nimra Raza. I'm a medical professional and health researcher, and on this channel, we break down complex medical science into clear, practical understanding, without hype, without fear, and without false promises. PCOS matters deeply, not just because it affects fertility, but because it's strongly linked to long-term metabolic health, cardiovascular risk, insulin resistance, and overall quality of life. Understanding the real cause isn't just about managing periods or hormones, it's about protecting your future health. Now let's talk about where the confusion starts. Most women are told that PCOS means their ovaries are covered in cysts, so naturally they assume the cysts are the disease. But in reality, those so-called cysts are not true cysts at all. They are immature ovarian follicles that never completed ovulation. Think of it like a traffic jam. The problem isn't the cars, it's the traffic signal that isn't working properly. The follicles are just the visible result of a deeper signaling issue. This is where things get interesting. The core driver behind PCOS in the majority of cases is insulin resistance. Insulin is a hormone that helps move glucose from the bloodstream into your cells, so it can be used for energy. When cells stop responding properly to insulin, the body compensates by producing more and more of it. And chronically high insulin does something extremely important that many explanations skip over. It directly stimulates the ovaries to produce more androgens, male-type hormones like testosterone. At the same time, high insulin suppresses a protein made by the liver called sex hormone-binding globulin. That protein normally keeps testosterone in check. When it drops, free testosterone rises even further. So now you have a hormonal environment dominated by excess androgens. This disrupts ovulation, it interferes with follicle maturation, and it leads to irregular cycles, acne, hair thinning on the scalp, and unwanted hair growth on the face and body. The follicles don't rupture and release an egg, they stall, they accumulate, and on ultrasound, they look like cysts. But again, the cysts are the smoke, not the fire. Here's what most people don't realize. Insulin resistance doesn't always look like diabetes. Many women with PCOS are young. Their blood sugar may appear normal on basic labs, but insulin resistance can exist silently for years before glucose levels rise. Your pancreas is working overtime to keep blood sugar controlled, and that chronic insulin exposure is what drives the hormonal chaos. This is also why PCOS is closely tied to weight changes, but not caused by weight. Weight gain can worsen insulin resistance, but insulin resistance can also exist in lean women with PCOS. This is why saying just lose weight misses the biology entirely. Now let's zoom out even further. Insulin resistance doesn't act alone. Chronic low-grade inflammation plays a major role in PCOS. Studies consistently show higher inflammatory markers in women with PCOS, even independent of body weight. Inflammation interferes with insulin signaling. It disrupts ovarian function. And it affects how the brain communicates with the ovaries through the hypothalamic-pituitary-ovarian axis. Think of inflammation like static on a phone line. The message gets distorted. Add to that mitochondrial dysfunction, meaning your cells aren't efficiently producing energy, and now the body shifts into a stress adaptation mode. This is where cortisol enters the picture. Chronic stress, poor sleep, overexercising, undereating, or extreme dieting can all increase cortisol. Elevated cortisol worsens insulin resistance and further disrupts ovulation.
So, PCOS is not a single hormone issue, it's a network problem. Insulin, androgens, inflammation, cortisol, and energy metabolism are all interacting. This is why quick fixes fail. This is why suppressing symptoms without addressing the root biology often leads to frustration. And this is why PCOS can look so different from one woman to another.
Now, let's talk about something else that's often misunderstood. Birth control pills are frequently prescribed as first-line treatment for PCOS. And to be clear, they can be helpful for symptom control. They regulate cycles, they reduce androgen effects, they protect the uterine lining. But they do not fix insulin resistance. They do not restore metabolic flexibility. They do not address the root cause in most cases. That doesn't make them bad. It means they're a management tool, not a cure. The same applies to many supplements and trendy protocols. Without addressing insulin signaling, inflammation, and lifestyle context, results are limited. So, what does applying this knowledge actually look like? It starts with understanding that consistency matters more than intensity. Stabilizing blood sugar throughout the day is foundational. That means balanced meals with adequate protein, fiber, and healthy fats, not extreme restriction. Regular movement improves insulin sensitivity at the cellular level. Not punishment workouts, but sustainable activity that your nervous system tolerates well. Sleep is non-negotiable. Poor sleep alone can worsen insulin resistance within days. Stress regulation isn't optional, it's biological. Your ovaries respond to your nervous system. And timing matters. Irregular eating patterns, chronic underfueling, or constant snacking can all affect insulin dynamics differently, depending on the individual. This is also where personalization matters. PCOS is a spectrum. Some women are more inflammation-driven, others are more stress-driven. Some are primarily insulin-driven. One-size-fits-all advice fails because biology is not one-size-fits-all. Now, let's talk about common mistakes. One of the biggest is focusing only on weight loss instead of metabolic health. Weight may change as insulin sensitivity improves, but it shouldn't be the only marker of success. Another mistake is extreme carbohydrate elimination. For some women, this worsens cortisol and disrupts cycles further. Another is supplement overload without understanding mechanisms. More is not better. And finally, ignoring mental and emotional stress. The brain is not separate from the ovaries. If you have PCOS and are trying to conceive, or managing symptoms, or protecting your long-term health, medical guidance is essential. This information is educational, not a substitute for personalized care. But understanding the root cause changes everything. Because when insulin sensitivity improves, androgen levels often decrease. When inflammation lowers, ovulation becomes more regular. When cortisol stabilizes, hormonal signaling normalizes. And over time, those cysts often resolve on their own because the traffic signal is finally working again. Now imagine the long-term benefits of addressing PCOS at the root. Better energy, improved metabolic health, lower risk of type 2 diabetes and heart disease, better brain function and mood stability, healthier aging. PCOS does not mean your body is broken. It means your body is adapting to an environment it perceives as unsafe, metabolically, hormonally, or neurologically, and adaptation can be guided. So here's the key takeaway I want you to remember. PCOS is not a cyst problem. It's a signaling problem. And when you fix the signals, the symptoms often follow. If this perspective helped you see PCOS differently, you're not alone. And if you want to go deeper into how metabolism, hormones, and lifestyle interact, there's another video on this channel you'll find incredibly helpful, because understanding your biology is one of the most powerful tools you have. I'm Dr. Nimra Raza, and I'll see you in the next video.